started your timer, and here is your question. Right, so if you have read and understood, considering it clinical examination session, kindly begin.
Hi, my name is Shiva, one of the surgical doctors here. Can I ask you your name and age, please?
It's Lisa, 55 years old.
Hi, all right, so you're a look, feel, I'll do a few tests. Is that okay for you?
Yes.
All right. So, So, do you have any pain at the moment?
No, not that much. Go ahead, please.
All right. All right. So, can I see your hand? Can you show me your hands, back of your hands, please?
Yes.
All right. So I will be. Should I speak what I'm looking for?
Yes.
So I'm looking for any skin changes, including any erythema, any scar mark, any and then I will be looking for any muscular abnormality, any bony abnormality, including any nodules and like that. And can I see your palms of the hand, please? So yeah, I'm looking at your palm, including palmar erythema, if there is any abnormality of the bone, including contractures, and if there is any any nervous swelling, any musting, skin problems, and then I will have a look on your. Can I ask you to join your fingernails together just to see if there's any clubbing, and then I will start palpation, and palpation I will start from the temperature tenderness. After checking the temperature tenderness, we'll have radial pulse and radial ulnar, both the pulses, and then to check for the movement. And in the movements, I will be asking.
Wait. She's back. You can continue. She's back now.
All right. So so then I would.
Yes, please continue. Sorry, I got disconnected.
Yeah, and then I will be doing the movements, and then like flexor digitorum superficialis and flexor digitorum profundus separately.
For palpation, you have to feel the ulnar border of the elbow, from the elbow to the hand, for the rheumatic nodules, and you have to do the bimanual examination of the wrist. All the joints, even of the snuff box. Yes, then you'll move on to the movements. Yes.
Okay, all right. Okay, and I will do active movements to check the power, and I will repeat all these movements. And next I will go for the thumb movements, and after I'll ask the patient to bring your thumb with your fingers away from the finger, towards the palm, away from the palm, and the next I would be like, this is how we check flexion, abduction, and flexion extension. And then I will be checking opposition, asking the patient to bring your thumb towards the little finger, and then I will be checking power grip. I'll ask
after the active movements, you'll do the passive movements.
Passive, yeah.
Then
yeah.
hand function, then power grip, pincer grip, and yes.
Yeah, I'll ask to hold the finger and squeeze my finger, and then I will be asking for a pincer grip, in which I will place something between the thumb, like paper, and the pincer grip, and then I will ask the patient to, can you pick up this pen for me, please? Yeah. So yeah, and then I will be doing motor functions and the sensory functions. In the motor functions, I will be checking median nerve by actually with the
tell the two tests that you'll do for median nerve.
For the median nerve, well, I would be doing for the motor functions.
Yes.
This okay. So I will be. Actually, in the motor function, I'm not sure which test, because in the sensory functions, I know a few tests, like Tinel test for the median and Fallon test. But for the motor function, we just do the thumb abduction, like asking the patient put the hands on the table and can you point towards the roof, and then checking the other is like making a face and doing the from its sign, which is actually grasping a paper between the index and the thumb, and then the radial is like actually doing extension at the wrist plus at the fingers against resistance. So that's how I will check the motor. And for the sensory, I have I'll check volar aspect of the index finger for the C6 for the median actually, and then similar the middle finger for C7 volar aspect, and then C8 to check C8 I will be doing basically little finger C8, yeah, and first dorsal web space for the radial nerve. And afterwards, because the patient had tingling sensation, so likely having a problem with the median nerve. So what I would be doing, I would be doing modified Durkin test, Tinel and Fallon test. And then in order to complete my examination, I will do complete neurovascular examination of the upper limb and the elbow joint.
Okay, so can you present your case now?
Yeah, so so I've seen 55 years old lady who presented with complaint of pain and tingling sensation for last 3 months. On inspection, there is no any abnormality, any skin abnormality, any wasting of the thin R.
Yes.
In median nerve, usually it's there.
So what are your differential diagnosis?
Okay.
Your differential diagnosis.
So my differential diagnosis according to examination is it could be carpal tunnel syndrome. It could be cervical disc disease, and it could be diabetic neuropathy. It could be any
so how would you confirm your
trauma. It could be because of the rheumatoid arthritis.
How would you confirm your diagnosis?
So after history and examination, I will obviously do some special tests, which includes Durkan's test, Fallon test, and Tinel test. Sorry. For these tests, I'm not sure if I. Oh yes, I think we can do EMG and
Yes.
nerve conduction studies.
Yes.
And maybe MRI hand.
Yes, to rule out carpal tunnel. Any labs that you'll in particular consider? Blood glucose and thyroid function.
I will just have a.
So can you please tell me the treatment?
Right. Blood glucose and thyroid functions.
Yes. Treatment.
Treatment depends on the underlying cause. If it's carpal tunnel, I would be starting from analgesia, and analgesia could be NSAIDs and could be steroid injections, and we can do splinting of the wrist.
Yes,
and definitely if it's not relieved by the if conservative management is failed, then we will go for the surgical treatment, which includes actually we release the carpal tunnel.
Yes. Good. Thank you. In between, I was disconnected.
It's very lengthy, to be honest.
Yes, but you have managed it.
It's very lengthy.
The ones you couldn't, I told you in between, so you covered it. Good. Thank you.